When I came home from college, my freshman year, I went to the doctor. Eventually he found out that my cortisol levels were really high. And I didn't know what this meant at first, but then he sent me for more testing. I had to do like urine samples and then an MRI. And the MRI found a tumor on my pituitary gland. And it caused all my cortisol levels to be high, and it's actually called a Cushing's disease. So I went in for surgery on July 25th to get my tumor removed, and the surgery was a success. But during the process of surgery, a blood clot formed and traveled to my lungs.
Her hospital course was complicated with the development of respiratory failure, pneumonia, sepsis, blood clots to her lungs, and ARDS, which is a condition that involves severe inflammation of the lungs. A patient like her or any other patient with this many complications cannot stay at a short-term hospital for this long. And here at Kindred, we specialize in treating complex medical and surgical patients, and especially patients that have difficulty coming off the ventilator.
She was trached in on the ventilator, total assist for breathing. She was actually also total assist for bed mobility, transfers.
I always was scared because I was at the mercy of other people, and I had to completely depend on everybody around me for just living, breathing.
It was very hard at first to get her to realize, you know, she can get better. She's going to get better.
Because it was a brain tumor, she had some residual weakness of her extremities. She was not initially able to walk, and our support staff did a wonderful job with her.
They were very helpful, they were encouraging, and they pushed me to get better.
It took us almost about 2 months to get her off the ventilator and to be able to have her breathe at her own once again.
I was really excited when they put the talking valve on, because then I could actually like talk and I didn't have to mouth everything, and it just became so much better.
She weaned off the ventilator to the aerosol trach mask and then was later decannulated.
Kindred really helped me breathe again, and by the time I left there, I was breathing again.
Prior to discharge, I was able to walk with a walker and was transferred to a lesser level of care for further rehabilitation.
She's very young. She has a lot, you know, a long life ahead of her. I was very happy to see her be able to get off the ventilator and go home with her family. She wants to go to college. I mean, she has a bright future in front of her.
She actually expressed some interest in going into the field of speech-language pathology.
I received speech therapy while I was in the hospital, and I was like, I want to do this is awesome. And especially because I can relate.